Assalamualaikum and hi, I'm Dr. Juliana Yusof. I'm an obstetrician and gynecologist from Faculty of Medicine, UiTM Sungai Buloh. So for the Intellect 2020, my project is on YouTube e-learning and easy approach to enhance medical students' understanding. Right, for introduction, actually YouTube has been widely used in preclinical and clinical teaching, of which D.S. Berry et al. He revealed that 78% of second-year medical students in a college in Dublin actually use YouTube as a primary source of anatomy-related video clips. In another study in Venezuela, about 85% of first-year medical students used YouTube videos to study human anatomy. As for clinical years, in a study by Wilhelm Rabi et al., he concluded that YouTube had become one of the main sources of information for OSCE and practical skills. So in view of COVID-19 pandemic, the medical students, especially in their clinical years from year 3 to year 5, they have limited clinical exposure due to restricted access to teaching hospital. So therefore, the teaching needs to be conducted online. And since teaching clinical subjects are really tough, YouTube is a good platform to reinforce medical students' understanding, as the educational video can be played repeatedly upon students' need. So my objective of this online video tutorial by YouTube is to give medical students a deeper understanding and visual explanation, as for my topic is on postpartum hemorrhage, and this will make the learning more efficient and easier. And my another aim is to create educational content for test or exam preparation for the students, for them to prepare for their on open book exam. So the methods that I use is that I use the references from the latest guidelines and journal, of which I use mainly the RCOG guideline from UK, and the lecture slides were voiced over using PowerPoint. I converted them to MP4 before I downloaded in YouTube. So this is part of my lecture on postpartum hemorrhage, one of the slides showed. And for student assessment, what I use is Kahoot, of which I use it for single best answers. And I use Google Form to assess student knowledge on OSCE, which was linked with CertifyM, a software, as well as I inserted 2 problem-based questions, of which the student's answer will be corrected by CertifyM, and results will be recorded in an Excel sheet. The corrected answers will be emailed to the students, and the certificate will be awarded. So this is the example of my single best answer question in Kahoot, as well as in OSCE. This is the Excel sheet which I have certified and have analyzed. Alright, and these are the Google Form result analysis of my SBA as well as OSCE questions. This is the problem-based questions which I have conducted online. And this is the example of the certificate I awarded to my students who have answered the questions. So for commercialization, I hope that YouTube channel can be launched in the future, as the benefit is it can generate passive income to the university and it's absolutely free. So look at these 2 pictures. What are these possible diagnoses? So the first picture here, you can see that the skin is discolored. It's color yellow with multiple purpuric rash. And this patient has underlying health syndrome, which stands for hemolysis, elevated liver enzyme, and low platelet. So because of this elevated liver enzymes, the patient appears as jaundice. Because of the low platelet, the patient had this purpuric rash. So this second picture, look carefully. This is the white island in the sea of red, and yes, it's related to dengue infection. Dengue infection can lead to thrombocytopenia. So it's very important, if the patient has thrombocytopenia, to ask if the patient has underlying fever or live in a dengue outbreak. So these are my references which I've taken, and I really thank you for listening to my video.